right, good morning. Happy Monday. So you guys read chapters 5 and 6 over the weekend. 5 was on dementia. 6 was on skills, which we cover in class. Do you guys have any questions about anything that you read or any of the questions in the book? Questions? No? All right, let me go ahead and get your scores. Daisy? Chile? Thank you. Emily? Madison? Thank you. Oops, Jake, can you mute me, please? Michael?
I did it, but I didn't grade it.
Okay, that's fine. Sydney? Natalie? On both? Thank you. Adrian? Dakota? Okay. All right, Cheyenne?
I got 2 wrong on chapter 5 and 1 wrong on chapter 6.
Thank you. Sierra? Yased? Yaleen? Uni? It's fine. That's fine. All right.
I just finished reading mine.
Okay. What, 95 on both? 85?
On chapter 5 would be 95.
Okay. All right. All right. Class is half over. Half over. We're at the halfway point. It goes fast. It really does. Only 3 classes left after today. So if you've not registered for the test, you might want to consider thinking in that direction. That way, you're not waiting so long after graduation to be able to test, and life will get in the way. It will. We've got back to school now, and then the holidays are coming, and before you know it, a year has gone by and you never did the test, and now you're not confident in your level of ability because it's been so long since you were in class. So register for the test. You guys are way more prepared than you think you are. And the reason for that is you compare your knowledge to me. And that's not fair. I'm not entry level. I've been doing this for 30 something years. So don't compare yourself to me. Remember, during the test, they're comparing you to other yous. And you are definitely prepared for the test. Okay, good. All right, game show will be not tomorrow, but next Tuesday, we will have a game show. And so it's the last week of the program. And I'm reminding you now so you can kind of mark your calendars, because that one is probably going to matter to you. It's right before graduation. You're now thinking about the test. And this gives you an opportunity to see 15 test-like questions, how they're going to be presented, the format they're going to be in, the type of knowledge that they're going to ask you about, and how the questions are going to be worded, because they're not straightforward. Most of them are going to be scenario-based questions. So it kind of gives you an idea of how to, what to expect on the state exam. So the game show will be not tomorrow, but a week from tomorrow at 11 a.m. All right. How do we know what to do with each patient? The care plan. We follow the care plan, the whole care plan, and nothing but the care plan. That means we don't change it, alter it. It has to be what it is. If we can't follow the care plan, who do we tell? The nurse, right. Do we get another CNA to do a task that we're not comfortable with? No. What do we do if we're not comfortable? Tell the nurse. So there's only 2 options for CNAs. We either do what the care plan tells us to, or we tell the nurse. That's it. So how hard can the written test be, guys? Those are your only two options. That's it in your scope of practice. But there will always be an answer that tries to get you to go outside your scope of practice and make a decision. So we have to remember what our role is when we're taking that written test. Okay. The questions aren't going to be very hard because this is your scope of practice right here. This really is it. While we're doing those tasks, we need to observe for any abnormalities, and then we'll report everything back to the nurse. Every skill starts with an opening. Every opening starts with a knock. And that, I want that saying to be foremost in your brain when you go into the clinical skills test. Because when they hand you your care plan and they read it to you and then they give it to you, your brain is going to freeze because this is real. We are being tested and you will freeze. It's a stress reaction. And your brain is going to be like, I don't know what to do. I don't know where to start. What do I do? I want you to remember this one statement. Every skill begins with the opening, and every opening begins with a knock. Because once you do that, your body will kick in with muscle memory. Okay. You just have to know that starting point. And I've had hundreds of students that have come back to tell me that that one statement saved their test. So if you can't remember what to do, every skill begins with the opening. Every opening begins with a knock. Okay. Once you've knocked, you don't have to wait for come in or anything like that. You're going to enter the patient area and address your patient by name. Make sure you're greeting them as well. Good morning, good afternoon. How are you? Make it nice, but greet them by name. We don't use ID bands. Oops, I went too fast. We don't use ID bands. We don't call them honey, sweetie, dear, nothing like that, by name. Then you're going to introduce yourself by name and title. You want to let them know what you're there to do, and we're going to get permission. Now, interestingly enough, I actually don't like this, but interestingly enough, there is no checkpoint that asks if you got permission to do the skill. It's not a graded checkpoint. Now, there is a checkpoint that says address preferences. So by asking them, is this okay? You're getting that preference check mark. But there is no check mark specifically for did you get permission or consent? I don't like that. I think it should be a checkpoint all on its own because it really is very important. What if the patient says no? What if they refuse? Ask why. Yeah, be nice about it, but get that information. And then who do we tell? The nurse, sure. Once we've got permission, we're going to close the privacy curtain because privacy counts. Is that curtain clean? So what do we want to do after? Wash our hands. And now that we have clean hands, we can go get our clean supplies. Very good. Very good. One of the supplies that we might need are gloves. Maybe. Do we wear gloves for everything? No, we have to decide when gloves are appropriate. Now, all weekend long, I worked on the online course. And I created a few lessons that I felt needed to be created. And one of the lessons that I created is not live yet on the course. It will be next week. Has to do with this. I created an activity where they look like flashcards, and on the screen is like a little person, and it tells you about the person and the task. So take a radial pulse on this patient. There are no skin openings. Do you need gloves? And then the next one would give you a different scenario. Do you need gloves? And it will help you quickly develop that ability to figure out whether you need gloves or not. Okay. So that, for those of you who are in the online course, remember all of you have access to it, but that glove activity will be available a little bit later on next week. Okay. So if we're not going to wear gloves for everything, how do we know when we're supposed to wear gloves if we're going to touch? Yep, non-intact skin, body fluids, and personal skin. So I don't want to be up in anybody's business without gloves. It's just a little too personal. Okay. So anything normally covered by a bathing suit, you would want gloves on when you're touching. Good. If you have worn gloves, you've got to pay attention to what else you're touching in the environment after you've touched the patient, because we don't want to contaminate a lot of stuff. And then we have to remove our gloves correctly. We pinch up and then we go under. Did you guys hear about, I want to stop and talk about this really quickly. I'm going to do a podcast eventually because there is so much opportunity out there for this. Did you guys hear about the nurse that they arrested in Florida? Anybody hear about this? Yeah.
Oh, I think she was pretending. to be
Yes,
Oh,
she
okay.
wasn't a licensed nurse.
And she provided care for hundreds of patients, right?
Yes, hundreds of patients that now allegedly, now, I don't have all of the detail, I'm not a law enforcement person, so I'm going to say allegedly here because she hasn't been convicted. But from all of the evidence that's been put out on social media, of course, it's not a court of law, she did graduate from a nursing program. Does that really make it any better?
She didn't obtain license.
But she didn't get her license. So I bring that up for a very specific reason, not to shame her or anything like that. She'll have her day in court and that will all, filter out. I'm very, very concerned about the facility that let this happen, right? Somewhere along the line, somebody dropped the ball. But even more importantly, you're going to be working with nurses. And those nurses are responsible for developing your care plans. If that nurse is not a good nurse, your care plan is not going to be a good care plan. Does that make sense? So here's somebody that's not just not a good nurse, but how sure can we be about her care plans if she's not state tested? So you have no way of knowing what type of nurse you are going to be assigned to work with. You have no way of knowing that. You have no way of knowing if that is a good nurse or if everything was addressed on that care plan. And I want you to keep this in the back of your mind. We follow care plans and report to the nurse. That is our role. However, if you notice that things aren't being addressed, it is okay to speak up and say, hey, there's nothing on the care plan about mouth care for this person and they can't do their own. Or, hey, this patient hasn't gotten out of bed in 3 whole days. And there's nothing on there about turning them or getting them out of bed or, there's nothing. So when you start to work and you notice these things based on what you've learned in CNA school, make sure that you speak up for the patients. Does that make sense? Because you never know who you're working with. You just don't. Now, as crazy as that situation was, we actually had one very similar here in Hernando County. About, I don't know, 10, 11 years ago. And it was through our school board. Somebody impersonated a nurse to get a position as a nurse in the school system. So it can happen. It can happen anywhere. This one just happened to make national news because she took care of hundreds of people. All right. If we need supplies, we need a clean place to put them. So we're going to use a barrier. Remember, anything can be a barrier, anything. But you want to go get your barrier first before you put it on, before you put your supplies on the table, because your supplies can't touch your uniform. What kind of hands do we need to get our supplies? Clean hands. So we're going to wash our hands, go get the barrier, put it on the table, go get our supplies and put those on the table. Don't hold anything against your uniform. One of the supplies you might need is a privacy blanket. We don't use them for every skill, but we will use one if the patient is uncovered or undressed during the skill. And remember, they're used both for privacy and for warmth as well. We're going to put it on without snapping it or shaking it, pull the sheet down underneath. And when you go to remove it, you want to remove it after you've taken off your gloves, because you don't want to touch that sheet that's going to go right up next to their face. Other supplies you might need are linens. So these are towels and washcloths and sheets and clothing and privacy blankets and patient gowns and, linens. So a lot of these are repeats, right? You have to have clean hands to get your linens. You can't let your linens touch your uniform. You don't want to snap or shake linens, and nothing goes on the floor. Not clean, not dirty, nothing on the floor. Anything you take that you don't use, what do we have to do with? Dispose of them, right? And we also learned that clean rolls toward me and dirty rolls away. We learned that when we learned changing an occupied bed, but that's also going to apply to some other skills that we do that require a chucks or underpad under the patient. Same process. The patient must be in the middle of the bed at all times, and we don't have side rails to keep them safe. So in order to make sure the patient is in the middle of the bed after a turn, you're going to scoot them towards you first and then roll them away from you. You always want to remain behind the patient's behind. Remember, patients must always be in the middle of the bed. Anything we wash, we rinse. Anything we rinse, we dry. So we don't put soap in our basin because that keeps our water clean for rinsing. To get water in the basin, we're going to use a paper towel to turn the water on. We should check it. It should feel warm, not hot, not cold, just warm. And your patient should also check it as well. If the skill takes a long time and that water starts to cool down or somehow gets sudsy, because you put soap in the water or something, change the water out. Don't ignore it. Those evaluators do see that, and they are looking. It is a checkpoint. Try not to get your surface wet. That's why we have barriers or towels on the bed or whatever. And if we're going to apply lotion, we warm it up first and then wipe off the excess. Anything that holds a fluid has to be clean. And the way it's cleaned is the way everything is clean. We simply rinse it, dry it, and store it. That's all that's required for the test. Rinse it, dry it, and store it. Okay. All right. And then the closing is at the end of every skill. You want to make sure the patient's in a clean and safe environment. So look around, make sure everything is picked up, barriers thrown away, your supplies have been stored, the bed is in the low position. You want to ask them, are you comfortable? They need to hear that word, comfortable. You've got to give them the call light. Offer something for entertainment, a magazine, a book, something. And then we'll open the privacy curtain. Once all of those things have been done, we're going to go wash our hands. We have to end skill with clean hands. So if we have to chart, we're going to wash our hands again at the end. Good? All right, so the skills that we've learned so far, we've learned how to take a pulse. This is the measurement of the heart rate over 1 full minute. So we're going to find the pulse at the bendy part of the wrist near the thumb, 2 fingers, fingertips, not flat area, on the pulse, thumb on the back, and we're going to count for as long as the care plan tells us to. For the test, that's 1 full minute. Normal is 60 to 100. In Florida, you have to count with 2 evaluators. You do have to document for this skill. We learned how to dress a resident with a weak arm. The way we remember this is USA first. Undress strong arm first and dress weak arm first. So we'll ask them what they want to wear. You want to provide privacy during this skill. Get your clothes before you undress them so they're not laying there, you know, completely undressed waiting on you. You want to support all extremities as you lift them. Make sure at the end everything lines up well. The buttons are all lined up. The pants are over the hips. The toe seams over the toes. Make sure they look good. How would you want to look if somebody were dressing you? Don't overextend or force movement. Everything goes in the hamper that comes off of the patient. Nothing on the floor. Remember that. Nothing ever on the floor. And then we'll put the call light in the stronger hand. We learn how to do hand and nail care. So hand and nail care is a mini mani. We soak the hand, we take it out and put it on a towel so there's a soft surface, and we wash the hand. We put it back in the basin to rinse, take it out to dry. Clean under the nails with the slanted end of the orange stick, wiping it off in between each nail, and then file the rough edges toward the middle. Warm the lotion up, put it on, wipe it off, and then clean up your environment. It's a pretty easy skill overall. Takes a little bit of time, but it's a pretty easy one. Along with that, we also learned how to make an occupied bed. So this is kind of a magic trick. You change the bottom sheet and the patient stays in bed, but the way we do that is clean rolls toward me, dirty rolls away. So we'll take that dirty sheet, unhook it from the mattress, roll it toward the patient, place the clean sheet on, hook it on the mattress and roll it toward us. Tuck the clean under the dirty. Go around to the other side of the bed, do it all again. Put it on a top sheet and a pillowcase. Don't hold clean linens against you when you're getting them from the supply shelf. When you put the top sheet on, you want those bottom corners to be tucked under the mattress. Hospital corners are best, but if they're not grading you on how pretty they are. But they are grading you on loosening that sheet over the toes because we don't want a tight sheet to pull those toes down. When you put the pillowcase on, you want to do that last to limit the amount of time the patient is without their pillow. And the opening should face away from the door, but that's not a graded checkpoint. Side lying position. I love this skill because you can turn somebody way bigger than you if you position them properly to begin with. Have them scoot toward you, furthest arm up, closest arm crosses, closest knee bent, furthest knee angled. Get them in that position and they just roll right over. No stress. But then we need some pillows to keep them there. So one pillow behind the back in a roll, one between the legs, specifically between the knees and the ankles so they don't rub. One under that top arm to get it in a neutral position, and then adjust the one under the head. Call light goes in the bottom hand so the cord doesn't come across their neck. We learned how to do foot care, just like hand and nail care, a little lower, nothing with the toenails. So soak the foot, wash the foot, rinse the foot, dry the foot, lotion the foot. That's foot care. But make sure you look at the foot. That's an important part of foot care is looking. We're going to put their shoe and sock back on at the end of the skill. Mouth care. It's brushing teeth. We know how to do this. But make sure your patient is in what position? Sitting, upright position. So we've got to get the head of the bed up before we start brushing teeth. It doesn't matter when you do it. But if you're going to touch the bed controls, I would use a paper towel because your hands are clean and the patient doesn't want dirty hands when you're working with things that are going to go in their body. Make sense? Okay. Little bit of toothpaste. So wet your toothbrush first, put a little bit of toothpaste on, brush all surfaces, let them rinse and spit as much as they need to, and wipe their mouth off after so they're not a drippy, wet mess while you go clean up. Yes.
Mouth care usually is done with gloves, right?
Well, it's a body, saliva is a, bless you, Jake. Saliva is a body fluid. So yes, mouth care would require gloves because that meets our glove rules criteria. Respirations. This is breathing. So in and out counts as one. Don't let the patient know that you're counting their breathing. We tell them we're taking their vital signs. So we're going to pick a starting point on the clock, look at the patient's chest, hold their hands so they think we're taking their pulse, and count how many times they breathe over a full minute. We'll count however long the care plan says, but the reading is over a full minute. So if we only counted for 15 seconds, what do we have to do with that number? Multiply by 4 to get us a full minute reading. Normal is between 12 and 20. Yep. Because if you just stand, imagine how awkward this is, okay? I'm going to get your vital signs. I'm staring right at her chest without talking to her. How high is that on the creep meter? Pretty creepy, right? Eventually, she's going to look up and go, what are you doing? This is awkward. This is not cool. But she also will probably clue in that we're counting her breathing. And what do you think that's going to do to her breathing? Yeah, it changes it. It usually speeds it up because now we're making them anxious. And anxiety makes your breathing and heart rate go up. So we're not getting an accurate reading. So if we make them think that we're taking their pulse, it just kind of levels them out and we're going to get a more accurate reading. Good? Good. That's a documentation skill. Range of motion. We've learned one of these, range of motion. We still have 2 more to go. But range of motion, we're going to do whatever exercises are indicated on the care plan, whatever repetitions are indicated on the care plan, on the body part indicated on the care plan. So the care plan is going to tell us what body part, what exercises, and how many times, and we're just going to follow that. Up, down is flexion extension. Up, down. Up, down. Side to side is abduction, adduction. Now, not all joints can move in all directions. So abduction, adduction of the shoulder would look like this, right? But the elbow doesn't abduct, it doesn't do that. The elbow is a hinge joint. It only goes one direction. This is it. If you get an elbow to do something other than this, you broke it. That is all an elbow is designed to do. Okay. So not all joints can move in all directions. We're going to follow our care plan. Rotation is around, like your wrist. If you do this, wave a magic wand, that's rotation. But our care plan for elbow and wrist isn't going to have us do rotation. It just says flexion extension. So flexion extension of the elbow is up, down. Flexion extension of the wrist is up, down. Support the joints as you exercise. No, you can say up and down. Yeah, you can put this in terms your patient understands, but your care plan is going to say flexion extension. So you have to know what that is because you're reading the care plan, but you can tell the patient, I'm going to move your arm up and down. And I always put this in actions my patient understands because I know they're nervous. They're in a strange place surrounded by strange people, most of whom are coming in and hurting them. They don't have a whole lot of faith in me, right? They don't know me. So if I walk in and say, I want to do some exercises, they're automatically going to think this is going to hurt. So I usually put this in terms my patients can readily understand. Like I am going to lift your arm towards your shoulder and back down like you're making a muscle. And they'll mentally think, oh, making a muscle, I can do that. That doesn't hurt. Okay. And they'll relax. I'm going to move your wrist up and down like you're revving a motorcycle. Up and down. Okay, I can do that. That doesn't hurt. And they relax. If they're not relaxed and they're stiff, it is really hard to get that range of motion because they're engaged. We don't want them engaged. We want them relaxed. So the more information you can give your patient on this, the more relaxed they'll be because we don't hurt patients. Not our job, not our role. We don't like to hurt patients. But does your patient know that? No. So we've got to help them understand that. All right. So speaking of range of motion, let's learn range of motion, hip, knee, and ankle. So this is going to be on page 80. So if you're looking on page 80, down the side here, you have the principles that are involved in this particular skill. You've got your skill-specific steps. The principles are all spelled out here for you in case you forgot in the last 20 minutes. We've got a video for this. And down here is test-specific information. So somebody with your level of experience should be able to do this skill in how long? 4 minutes. Yeah. This is a really quick skill. Remember, this is generous. They always give you more time than you need. This is generous. So this is like a super quick skill. This is going to be done on who? Another student, not a mannequin, because these mannequins don't bend like real people. Where's that person going to be? Okay, and charting is not required for this one. So today we're actually going to have a little bit of practice time built into class. So if you decide that you want to practice this particular skill, don't do it on the mannequin. Put the mannequin on the table or on the floor, or just get the mannequin out of the bed and have somebody lay down and do this skill on a live person. Okay. The only time you should be working on this mannequin is if it says mannequin right here. Good. All right. Nothing new to learn. Nothing new to learn on this. We already know to follow the care plan. We know to do our opening. We know to evaluate if we need gloves, and we know to do our closing. Nothing there to learn. And we actually know what we need to know about range of motion to do this skill, but let's review. So if you look on page 81, at the top of the page, you're going to see the care plan. Let's take a look at that care plan together. Oops, no, I don't have it. Hold on. All right, that care plan at the top, page 81, says, provide the following range of motion exercise to the resident's right hip, knee, and ankle. So which one are we exercising? Right hip. Can I do the left too because I'm there? No? But exercise is good for people.
What if they just had surgery on the other side?
Okay, that's right. We don't know why we're not doing it on the other side. All we know is care plan said right, so we're doing the right. That's it. The exercise that we're doing is flexion extension. Do you guys remember what motion that is? Up, down. Flexion extension is up, down. Provide 3 repetitions. Can I do 5? What if the patient's feeling good and wants to keep going? Nope. 3. 3 is what we do because our care plan told us to. Remember, easy answer. And it says the resident's not able to help with the exercise. So I want to talk about that statement real quick. There are 2 types of range of motion. There's active and there's passive. Active range of motion is if I ask you to do the exercise. So if you guys are all patients, stand up for me. Everybody up. We'll do our morning calisthenics. If I ask you to extend your right arm above your head like you're asking a question. So extend your right arm all the way up, get that elbow nice and straight, reach for the sky, bring it all the way back down in front of you. Let's do it again. All the way up, all the way back down, and one more. All the way up and all the way back down. Very good. Now we're going to bring our arm out to the side like a snow angel. So bring your arm out to the side, all the way up, and all the way back to the side. Let's do one more. All the way up and all the way back down to your side. One more. Last one. All the way up and all the way back down to the side. Okay, sit down. That was active range of motion. I told you what to do, but you're the one that actually did it as the patient. Okay. Active range of motion. If the patient can do that, that's way better than us doing it. But this patient, can we use active range of motion? No, we're going to do the work because it says the patient is unable to perform those motions themselves. You guys understand the difference between active and passive? Now, notice that I gave you examples of what I wanted you to do, like asking a question or like making a snow angel. That you guys know what those motions are. So it gave you something concrete to refer to. I wouldn't say, I want you to do abduction, adduction of your right arm. Your patient's going to go, that sounds hard. So when you're giving patients instructions for active range of motion, make sure you're using terms they can easily understand. Make sense? Good? All right. So that's our care plan. Now, I want to point out that it says hip, knee, and ankle. And that's going to be somewhat important here. Because with the hip and the knee, we're going to do both of those joints at the same time. So if I have a hip and a knee, if we lift that leg straight up without bending that knee, it can cause sciatica. And I'm going to show you why in just a second. So in order to prevent injury to our patient, when we lift the leg up, we have to bend the knee at the same time. So this is a 2-for-1 exercise. You can see the hip is bent and the knee is bent. So in the bed, this actually looks like the patient is climbing stairs. We bring the knee to the chest and back down to the bed. Remember, always return to start. It's not a full range of motion unless you end where you started. Always return, no shortcuts here. So hip and knee is always exercised together. Now, this is why. You have nerves, because we're not wireless beings, we're actually wired beings. So every impulse that goes to my brain has to come through a nerve. Now, this nerve that goes down the back of the leg all the way to the foot, this nerve is a really big nerve. And when it runs along the back of your leg, it's very tight already. When you try to lift a leg straight without bending that knee, it pulls that nerve super tight. And this causes something called sciatica, which is an irritation of that nerve. And it's very, very painful. And it's not the kind of pain that you feel and then it goes away. If we irritate that nerve, it can take months to resolve. Months. So we don't lift straight legs. This has to be done by a physical therapist, not us. So anytime you lift a leg, what do you have to do with the knee? Bend it. Always. All right. And then moving on to the ankle, it tells us flexion extension, which is up, down. So we're just going to bend the ankle forward and back. That's all we're going to do with the ankle. Super easy. But we don't want the heel to scrape against that sheet while we're bending that ankle forward and back. So we want to lift that foot off of the bed just a little bit so that that heel isn't touching the mattress as we're flexing and extending. Good? So we're going to follow the care plan. We're going to exercise the resident's right hip, knee, and ankle using flexion extension, which is up, down. Provide 3 repetitions of each exercise, and the resident is not able to help with the exercises. Remember, the care plan gives you all the information you need. So in the middle of the test, if you can't remember how many repetitions, what should you do? Go back and look at the care plan. Should you guess? No. Go look at that care plan. You can look at that care plan anytime during the test. Good? So let me tell you a little story. On Friday, I got a call from an instructor in Texas. Now, she used to be an instructor a couple of years ago, and she uses, there's most schools throughout the country use our book and our videos. We're very, very, very well known out in the CNA education community. I go to conferences. I'm a guest lecturer. I'm very connected with instructors all over the country. So I had gotten to know her a couple of years ago when she worked in Texas because I'd gone out there to do a speaking engagement. And she retired and hadn't heard anything from her for a couple of years. And then she called on Friday. So she said, I went to work for Prometric as an evaluator for a couple of years. She didn't like the travel, so she stopped doing that after a couple of years because it's a lot of travel for them. And she said, I want to tell you that I knew your materials were in alignment with Prometric standards as an instructor. She says, I did not realize just how in alignment they were until I became an evaluator. And she says, I can tell very easily who used your study materials and who didn't when they went to test. So we are absolutely in alignment. Now she's going back into education now. She's back in a high school and wanted to know if I had anything new. So I told her all about the new videos and the new stuff that we've got coming out. And she's like super excited because it makes their job easier, because as long as the students follow this, it's in alignment with the testing standards. So this is your care plan for the test. This is it. This is the care plan. This is what you're going to get. The only change that might be is instead of right hip, knee, and ankle, your care plan for the test might say left. Read the care plans and follow them. Good? So every skill starts with the opening. Knock, knock, knock. Hi, Miss Jones. My name is Patty. I'm your CNA today. I'm here to do some exercises. Is that okay? Close curtain, wash hands, get supplies. There's no supplies for this. So we're going to decide if we need gloves. Now, if my patient is another testing student, fully clothed, and I would assume that you guys are all holding on to your own body fluids like a champ, right? So there's no need for gloves for this skill. I am not going to touch any personal skin. I am not going to touch any body fluids. And you guys don't have any non-intact skin that I'm going to come into contact with for the test. But if I'm doing this on a patient in bed who is in a hospital gown, not wearing undergarments, and incontinent, do I need gloves? Absolutely. So the gloves aren't based on the skill. They're never based on the skill. They're based on the patient you're doing the skill on. Does that make sense? Okay. So we're going to lift from below. We're going to bring that knee up to the chest and back to the bed 3 times, watching for pain. So I'm looking at the face for grimacing, wincing. I'm listening for sucked in breath like, or groans, moans, anything like that. We're going to stop below the ow. So if I get to here and I get ow, the next one goes below the ow. And then what do I have to do with that information? Report it to the nurse. Hey, we got to here and got ow, and let the nurse figure out where the ow is for that. Let me talk to you about documentation in just a moment, because I do want to address that really quick. I just did a lesson on, for the online program about documentation. So we're going to move slowly and smoothly all the way to the start position. Flexion extension is up, down. Abduction, adduction is side to side. Rotation is around. We're going to ask about pain, monitor for pain, and then we'll do our closing. So let's talk about documentation as a CNA really quickly. Generally speaking, in most settings, not all, but generally speaking, CNAs are not allowed to document in words. You're not allowed to use words. You use numbers. So pulse, respiration, feeding percentages, urinary drainage bags, numbers. I know there's something on the screen. I'll get to it in a minute. Numbers. You also might be checking off tasks that were done. So check boxes, but not words. And that's because every medical record is a legal document. It would be like you going down to the courthouse, pulling a random court filing and just starting to write on it. Right? Only certain people can write on those forms because they're legal documents, and everything on there can be called into court. Well, that's the same thing with documentation. And because of that, because CNAs don't understand legal documentation and how to protect them and the facility, you're not allowed to write words. Make sense? So in most settings, we're not going to document that the patient experienced pain because we don't have the legal authority to do so. What we want to do is report that to the nurse, and the nurse can assess the patient and document that the patient experienced pain and what we did about it. Good? Make sense? Okay, Amazon girls, thank you. I passed my exams last Friday. Thanks to you, Miss Patty. Blessed day. Congratulations. Great job, Amazon. Good job. All right, so let's go ahead and watch this video for range of motion, hip, knee, and ankle, keeping in mind our skill-specific steps. Support, always support. We're going to bend the knee and the hip together, return to your start position, monitor for pain. All right, Jake.
Hello.
Hi, Mr. Jones. My name is Patty. I'm your CNA today. How are you?
I'm well. How are you?
Wonderful. I need to do some exercises on your right hip, knee, and ankle. Is that okay?
Yes.
Okay, I'm going to close your curtain. Let me go wash my hands, and I'll be right back. Okay, after washing my hands, we're ready to get started. The first exercise I'm going to do is bring your knee up to your chest and back down to the bed. I'll do all the work. All you have to do is let me know if there's any pain or discomfort. We're going to provide 2 points of support, one under the knee and one under the heel. And we're going to lift up and all the way back to the bed. Feel okay?
Yes.
Any pain?
No.
We're going to do it again. Up and all the way back. And one more. Up and all the way back. Feel okay?
Yes.
Okay, now I'm going to work on the ankle. I'm going to lift your leg off the bed just a little bit, and then I'm going to bend your foot forward and back. You should feel a little stretch. Please let me know if there's any pain.
Okay.
So I'm going to lift under the ankle. We're going to bend the foot forward and then back. Feel okay?
Yes.
We're going to go forward and back. Feel okay?
Yes.
One more, forward and back. Good?
Yes.
Is there anything else I can get for you while I'm here?
No, thank you.
Would you like a magazine before I go?
No, thank you.
Are you comfortable?
Yes, ma'am.
Environment is clean. Bed is in the low position. Here's the call light. If you need anything at all, just press the red button and we'll be happy to come help. I'm going to open the curtain and go wash my hands. After washing my hands, I'll review the care plan, think about my skill, make any corrections, and then tell the evaluator my skill is done.
Lift up.
All right, any questions on that? It's kind of an easy skill. You will get one mobility skill for the state exam. So mobility skills are all 3 range of motions. So range of motion shoulder, range of motion elbow and wrist, and range of motion hip, knee, and ankle, one of those 3. Or ambulate with a gait belt, which we're going to learn. Or transfer out of bed and into a wheelchair. Or side lying position. Remember that, turning them on their side? You will get one of those 6 skills. Guaranteed. You will get one of those 6 skills. Okay. If I got to pick, it would be a range of motion because it's quick. All right, so let's move on to denture care. This is going to be, our overview is on page 96. Trying to get through this pretty quickly today so that you've got the most amount of practice time available to you. So denture care, if you're looking down here at our overview, it's all going to be spelled out for us here. We're going to follow the care plan, do our opening, decide if we need gloves, and yes, you will, because, you know, saliva. We're going to use a barrier. We're going to employ linen rules because we don't want those linens to touch our uniform and nothing goes on the ground. We're going to clean the basin just like we clean everything else, and we're going to do our closing. Nothing new there. We do want to learn a little bit about the denture care steps themselves. This down here is your test-specific information. So time for this is 13 minutes. They're going to give you 13 minutes to do this skill. It doesn't take 13 minutes, but they're going to give you 13. But if you look right next to it, who are we doing this on? Oh, that's a problem. Because, yeah, it's denture care, and I don't expect all of you guys to go get dentures before class. So how does this work? Let's take a look and see why a real student can be a patient for this skill. So if you go to the top of page 97, we're going to read the care plan. They have thought of absolutely everything here, guys, absolutely everything. It says a resident with dentures is sitting at an overbed table with their dentures in a denture cup. So are we taking dentures out? No. It says the resident's denture needs to be brushed with toothpaste and the resident needs mouth care. The denture is stored in a denture cup after cleaning. So are we putting dentures in? No. So that's how we can do this skill on a live testing student. We're not taking dentures out. We're not putting dentures in. And in fact, CNAs don't take dentures out. And we don't put dentures in. If the patient can't do that themselves, they don't wear their dentures. We puree their food. We chop it up really fine so they don't have to chew. Okay. And the reason for that is there's a high rate of injury when you're taking dentures out. You actually risk dislocating somebody's lower jaw. It's a very serious risk. And that's because if you have dentures in your own mouth, to get them out, you've got to get your fingers way back here to pop them up and forward, like right back here in the corner, the edge of the denture, to pop them up and forward. Well, you won't ever put enough pressure on your lower jaw to dislocate it doing that because you would stop way before you dislocated, right? But you're also at a unique angle, right? You're like this, trying to pop those dentures up and out. So you're not putting a lot of pressure on that lower jaw. Now, that's different from if I were doing it. If I put my fingers in your mouth, in order to pop up the back part of the dentures, these knuckles right here have to press down on something for leverage. What are they pressing down on? The jaw. Yep. So in order to get that denture popped up, and remember that denture is held in by very sticky denture paste. So it's not going to come easily. In order to put enough force to pop that denture up, you might dislocate that lower jaw. That's not a good risk. Now, on the other hand, putting dentures in, not a good idea. Because when you put dentures in a mouth, the patient will automatically bite down to seat those dentures. It's a reflex action. They can't help it. So if your fingers are in their mouth, when they bite down, what's going to happen? Yeah, you're going to get bit. And because these are fake teeth, they're not attached to the patient. They have no idea how hard they're biting down. Not until those dentures are seated. So you risk serious injury to you by putting dentures in. Does that make sense? So who has to be able to take dentures out and put them in? Not the nurse, the patient themselves. That's right. If they can't, we puree their food. Okay, good. That could be a test question. That could be a written test question. So you have to understand that concept. All right. Step-by-step instructions on page 97. This one has a lot of supplies. We have to learn our supplies. Nobody's going to tell you, hey, I want you to go in and do denture care, and you're going to need a washcloth, a towel, a toothbrush, or a denture brush, a toothette, some toothpaste, water, emesis basin, and the denture. I mean, nobody's going to say all that to you. They're just going to say, go do denture care. You have to know what you need. So make sure you're learning these supplies. Okay. All right. So let me explain to you a little bit about dentures. And we have all this here for you guys to play with during practice time. All right, there are several different types of dentures. When we think of dentures, we tend to think of these guys. Okay, full plates. This is a full plate of denture. This is a top plate, and I know it because it's got the whole palate. This is the part that fits on the roof of the mouth. So if it's got this on it, it's a top plate. If it's cut out like this, cut out, that's where the tongue goes. So this would be a bottom. Good. Okay. So this is a full plate. We have replaced all of the patient's teeth, but we don't pull out teeth that are still healthy to give them fake ones usually. If they still have some healthy teeth, we would have something that looks more like this. This is a partial. A partial has some teeth replaced, but it also has cutouts for the healthy teeth that remain. Partials will often have some sort of a ring or hook to clip onto teeth that are already there to help them stay in place, help anchor them. Good. Now, in our practice kits, these practice kits, we actually have fake dentures for you guys to practice with. These won't fit in real mouths. You know, I don't give real dentures out. These things are expensive. But we do have these for you to practice with. They have a groove, just like a regular denture. You can brush them. So there's a way for you to practice at home with the practice kits. My mom actually makes those. We're a family, true family business. Yeah, I have my mom make those. So one of the things that makes this skill a little harder for students is the fact that we need 2 sets of gloves, not just one. So we're going to clean the dentures. We take them to the sink, we clean them, we put them back in their cup, and we put them on the bedside table for future use. We're going to clean the dentures because that's what the care plan told us to do. But we also have to clean the mouth those dentures came out of. Our care plan, again, told us to do that. They need mouth care. Do you think that patient wants the same gloves that just cleaned their dentures in their mouth for mouth care? No. So we have to change gloves in the middle of this skill. And this really messes students up. When do I change the gloves? What can I touch? And the answer is, it doesn't matter. The test isn't grading you on it. Just wear gloves for the dentures, wear gloves for the mouth care, change them in between. Okay? Don't get overly wrapped up in this. But I am going to give you some guidelines that might help you. Okay? Anything that you touch, good morning, that was used for the dentures, anything that you have to touch, you probably want to wear your denture gloves for. Anything that you're going to touch when doing mouth care, you want clean gloves for. And remember, what's the first thing our gloves should touch? The patient. So we're going to do all of our denture stuff. When we're done with all of our denture stuff, we're going to take those denture gloves off. We don't need them anymore. Throw them away. Now let's do our prep for mouth care. Put the towel on the chest, wet the denture or the toothette, put some toothpaste on it, get everything all ready, then put your clean gloves on right before you go to brush. Make sense? So it's the same rules, but the test isn't grading us really harshly on when we change. Just make sure you change gloves because nobody wants dirty gloves in their mouth. Okay, So I'm going to pass these around so you guys can take a look. This is, actually, I'll leave the lid off. This is the partial, and this is a full plate. These are real dentures. Dentures need to be stored in water. Otherwise, the material the dentures are made out of become very brittle and they'll break. So dentures are usually stored in water. And here, I'm not going to pass them around in water because you'll spill it everywhere. So you guys can take a look at the dentures. All right. So we need 2 sets of gloves. Our care plan is very specific here. Our care plan tells us the dentures need to be brushed with toothpaste. It's very specific. In most cases, your patient is not going to want their dentures brushed with toothpaste. Toothpaste is very abrasive. And dentures are very, or toothpaste is very abrasive. Dentures are not real bone. They're not real teeth. So when you brush dentures with abrasive toothpaste, it can actually cause little micro cracks to form. And those are areas that bacteria can hide in. So in a lot of cases, your patients have been told by their denture care people, don't brush it with toothpaste. Instead, put it in a cup of water with those little fizzy tablets. Now, those fizzy tablets actually break down the food particles and the denture. It's a chemical reaction. It breaks those items down and removes them from the dentures. So it cleans better than toothpaste and a toothbrush. Okay. Which method are we going to use for this patient? Whatever the care plan says. And the care plan tells us to brush with toothpaste. Which method are we going to use for your patients out there? Easy answer. Whatever the care plan says. If the care plan says fizzy tablets, what are we going to use? Fizzy tablets. We're always going to go by that care plan. Okay. Are you starting to see it's the same answer all the time? Never changes. If you catch yourself thinking, stop. You took a wrong turn. Okay. Now, to clean the dentures, we're going to use a special brush. You can use a regular toothbrush. It's fine. But most of the time, we use a special brush. This is a double-sided denture brush. Now, the reason we use this is because it has 2 sides. One of them is specifically made, it's small. It's specifically made to fit in the groove of the dentures. You know, the part where your denture paste is going to be. This is too big. It's not going to fit in that groove real well, and it's not going to clean that paste off real well. So we use this side for the groove and this side that looks like a toothbrush for the teeth part of the dentures. Okay. So double-sided denture brush is used to clean dentures. Now we also have another new item, which is a toothette. To clean the mouth, you could use a toothpaste, but remember, inside the mouth, you're going to have some of that denture paste. Now, that denture paste is going to get all wound up in those bristles of the toothbrush. And after a couple of seconds, it's not going to be very effective because you're not at the sink. You can't rinse it out. It's going to be all gummy. So instead, we often use this. This is a soft, spongy toothette or oral swab. They're called 2 different things. But it has 4 sides to it. And that's important because you have 4 quadrants to your mouth. So you can take this and swipe away that denture paste. Turn it a quarter turn. Go to the bottom and swipe away that denture paste. Turn it a quarter turn. Go to the other side and swipe away that denture paste. Turn it a quarter turn and swipe away the denture paste from the bottom on that side. And then you can just throw this away. It's disposable. So this is often used to clean dentures. This is often used to clean the mouth the dentures came out of. You could use a toothbrush for either one of these. It's okay. But these are much better tools for the job. And for the test, these are the tools you're going to have. All right. So whether we are cleaning the dentures or cleaning the mouth the dentures came out of or cleaning teeth, doesn't matter. This process is always the same. We wet our brush before we put toothpaste in it or on it. And then we're going to lay that brush in the basin to hold it while we're getting everything else ready. You don't want to lay a brush on a table. You don't want to lay it on the side of the sink. You got to have somewhere to put that brush that's going to keep it clean until you're ready to use it. So this process is the same, whether we're cleaning the dentures or we're using a toothbrush to clean the teeth or we're using a toothette to clean the mouth. This process is the same. We wet it, we put toothpaste on it, we put it in the basin to hold it till we're ready. Questions? Okay, so that's what the emesis basin, this guy, is going to do while we're getting ready to clean the dentures. Now, it's going to have a whole different job to do in a minute. But while we're getting ready to clean the dentures, this guy is just going to hold our denture brush. That's its job. Because when I take all of this over to the sink, I don't want to lay my denture brush on the side of the sink. That's just gross. We need it in a basin to keep it clean. So all this is going to do is hold that denture brush. And that's what this graphic is going to show you. You want the denture brush in a basin, not on the side of the sink. You can just leave them on your table for now. That's fine. All right. So I'm at the sink. I've got my denture brush. I've wet it in a cup of water. I put some toothpaste on both sides. I put it in an emesis basin. I went to the sink. I'm getting ready to start, but I need to put something in the bottom of that sink because if those dentures fall or I drop them, they're likely to break. So I need to put something in the bottom of the sink to make it a softer surface. And that something is going to be a washcloth. I want to put a washcloth in the bottom of the sink. If I can get it over the drain, that's even better. Because if I can get it over the drain, it's going to pool that water up. So if the dentures should fall, and they get really slippery, guys. If those dentures should fall, they're going to hit the water. And then they'll slowly sink down to the bottom of the sink. It's not going to be a crash. So I'm going to put a washcloth in the bottom of the sink, and if I can get it over the drain, even better. Now, when I turn the water on, I want to use a paper towel because just like getting water for bathing, my hands are clean. I haven't touched anything dirty yet. I don't want to touch that faucet with clean hands. So I'm going to use a paper towel to turn the water on. And when I do that, I only want to use cold water. Now, there's a principle here. Those of you who go on for nursing, you'll learn this. Heat coagulates proteins, which means nothing to you. When we use heat, hot water, it's going to make the proteins that we're trying to remove stickier and harder to remove. We don't want that. So cold is best to clean dentures, cold water. You don't want to make it harder for you to do your job, cold water. So we're going to use a paper towel, turn the water on. We want to use cold water. Make sure those dentures are always in your hand. Do not set them down in the sink. Don't put them on the side of the sink. There's only two places those dentures can live. Your hand or the denture cup. That's it. They don't go anywhere else. Be careful with that. That is a big graded checkpoint. Now, of course, we need some gloves on for this. Okay, thanks. We need some gloves on for this because we're handling dentures and that has body fluids on it. So I've done all of that prep work. Let me go back one. I've done all of this prep work. I got my denture brush ready. I brought it over to the sink. I put the washcloth in the bottom of the sink. I turned my water on, cold water only. I did all of this before I put my gloves on, because I want the first thing my gloves to touch to be the patient, or in this case, what came out of the patient. So gloves on, I'm going to pick up those dentures and they should remain in my hand throughout this entire process. Good? Good? Okay. All right, so then we're going to brush. We're going to brush whatever we see. For the test, you are working on real dentures, like what I just passed around, real dentures, but they're not going to be dirty. They haven't come out of a real person's mouth. There's no denture paste. They've been brushed about a bazillion times. They are not dentures that were used on a real person. We work with local denture providers, and when they have dentures that they're going to toss because either they didn't, they didn't work, there was a mistake on them, or the patient expired before they could pick them up, or the patient wasn't able to pay for them, or they toss these dentures. So we work with those people to get them for education purposes. They're not real, so they're clean. You're not going to have to work real hard to get them clean. They're already clean, but you are going to make sure that you cover every single surface with toothpaste. Okay. Don't set them down in the sink. Keep them in your hand. And then once those dentures are clean, we're going to hold the dentures in one hand and rinse the cup out with the other. Dump the cup water and then fill it up. Remember I said that dentures have to be in water, so we'll fill the cup with water, put our clean dentures in the cup, and then cover it. Where's the two places those dentures can be? Hand or the cup, that's it. Good? So clean dentures deserve a clean cup of water. Now, that cup of water has been rinsed. The outside of it is going to be wet. So we have water inside, we've got dentures inside, we're putting the lid on, but the outside is wet. Do we want to put the outside wet cup on a table? So I want to grab a paper towel to put underneath that cup as a coaster, just to prevent my surfaces from getting warped or damaged. Good. Now we can turn our water off. We can wring out our washcloth that was in the bottom of the sink and put it in our laundry hamper. Clean your environment. We're going to take that, we took the denture cup with the coaster underneath it and put it on our patient's bedside table, because that's what our care plan told us to do. We want to get rid of everything in our environment. And then we want to take that basin holding that denture brush to, to the patient area. Because remember I said this basin is going to have a whole nother job to do. So I want to bring this over to the patient's table, and I want to take my denture brush out and set it on the side while I still have gloves on. Remember, anything that we have that has to do with denture care, we're going to touch with our denture care gloves. Once this basin is empty and ready for its second job, we can take our gloves off. Now, once we've taken those gloves off, we're going to wet our toothette, put some toothpaste on it, and we're going to put the toothette in the basin. It's going to hold our toothette. Second job. We're going to put a towel over the patient's chest, and now we can start brushing the patient's mouth. I need gloves for that. So this is the time to put my gloves on. And then I'm going to brush whatever the patient's got using my toothette. It's disposable, so at the end, we'll throw it away. Dry your patient's mouth off. Don't leave them a drippy, wet mess. And then clean your environment. So we're going to clean our basin, dry it, store it. We're going to clean our table. Everything disposable gets thrown away. We're going to make sure our environment is clean, so the barrier's been thrown away, all of that, and then we can do our closing. You don't have to, because it's the same patient, same cooties.
Okay, I'm just thinking about like sweat. And
You can, yeah, you won't get in trouble for over washing your hands. So if you want to, you can wash your hands, but it's not required. Okay. So you guys understand all the steps of denture care? It's a long skill. It is a lot of steps. And students tell me that this is the hardest skill for them to learn. This is the hardest skill because there's a glove change in the middle. This is the hardest skill to learn.
Sorry. For the toothette, when you said you would clean four corners, do you clean it the fronts, the backs, and then fronts and backs, or do you do one side?
I do one side, the other side. Yeah, it doesn't, but it doesn't matter.
Including front and back.
Right. Yeah, it doesn't matter. As long as the mouth is clean. They don't care how that happens. Don't take a ton of time with this. Just get in there, clean the mouth. Remember those evaluators, where do they want to be? Home. If you are taking 5 minutes to meticulously go over every single one of those teeth, they are going to get irritated because you're not going to do that in a clinic. You don't have time for that in the clinical setting. Just clean the mouth. Okay. Good. Remember that our practice kit has these dentures in them, along with the toothettes and the denture brush and everything you need to practice. So if you're not getting enough practice time in here, consider getting one of these. For you guys during class, bless you, while you're enrolled in class, this is $49.99. If you purchase it on the website, it's $69.99? $64.99. So get it from us.
We also have a
Yeah.
number of them here, and we have more nearby as well. So
Yeah.
we have plenty available.
So you can get them from us for $50, right here, or $49.99. We'll give you a penny back. Or if you order them online, like the people that are attending virtually, I've got 25 of them on now. They have to pay the $65. They don't get the special rate. So order them from us. Okay.
Plus, you also pay shipping if you buy them.
Yeah, that's true. You don't pay. Yeah, you just get to save on shipping.
So you have them here, right?
Right. All of these bags. There's 2 different bags to choose from. There's a red drawstring bag, and then there's a gray tote bag. Just whichever one you like. The insides are all the same.
And that covers like all the materials that you need for each skill?
Absolutely. Every single skill is covered in there. It even has a privacy blanket.
Oh, wow.
Do I get a student?
It has, you get a student discount. That's the $49.99 is the student discount. It has the gait belt, the bedpan, the bath basin, the emesis basin, toothette, toothbrush, denture brush, chucks, gloves, graduate, everything you need to practice, and a privacy blanket as well. Good? Questions? All right, Jake, can you show denture care video? Please and thank you.
Hello.
Good afternoon, Mr. Jones. How are you?
I'm well. How are you?
Wonderful. My name is Patty. I'm your CNA today, and I would like to help take care of your dentures and perform mouth care. Is that okay?
Yes.
I'm going to close your curtain, wash my hands, get my supplies, and I'll be right back. I'm going to take your dentures to the sink to clean them.
Okay.
I'll bring the denture cup to the sink on the paper towel. We're going to set it on the side of the sink and open it, placing the lid beside it, and then wash my hands. After washing my hands, I'll get my supplies. We're going to start with a barrier. This is going to provide a clean place to put our clean supplies. So we'll spread the barrier out on the table with the absorbent side facing up. And for this skill, I'll need a towel and a washcloth, being careful not to let the supplies touch my uniform. I'm just going to go gather the rest of your supplies. I need a toothette, a denture brush, and toothpaste, along with an emesis basin and a cup of water. We'll set these on the overbed table. And I need 2 sets of gloves. Okay, I'm going to get the denture brush ready. We're going to wet it and apply just a little bit of toothpaste on both sides. Set it in the emesis basin right now. I'm going to take the washcloth, a set of gloves, and the emesis basin holding the denture brush to the sink. Mr. Jones, I'll be right back. I'm ready to clean the dentures, so I'll set the prepared denture brush in the emesis basin on the side of the sink. I'm going to place the washcloth in the bottom of the sink over the drain and put my gloves on. I'll take a paper towel and turn cold water only on because we only wash dentures with cold water, and we're going to throw that paper towel away. Now I can clean the dentures. I'm going to take them out of the denture cup and rinse them off, making sure that I hold them over the sink at all times. I'll take the denture brush, and the small end of the denture brush is going to clean the groove part of the dentures. So we're going to clean that whole groove, all areas, and the palate. Then we'll turn the dentures over, being careful to hold them securely, and use the other side of the denture brush to clean the teeth part of the dentures. We want to make sure that we cover all surfaces. Making sure that we hold it securely. And then we can rinse the denture brush and put it back in the emesis basin for later use. We're going to rinse the dentures off, removing all of the toothpaste. We'll take the denture cup, dispose of the water, rinse it out, and fill it with cool, clean water, placing the dentures inside. Cover it with the lid. We can throw this away and get a clean paper towel to place underneath it. I can turn the faucet off, and we're going to go put this on the patient's bedside table. I'll place this denture cup on your bedside table over here for use later. Now I can remove the washcloth and place it in dirty linen. Now I'll bring the emesis basin holding the denture brush over to the overbed table and take the denture brush out and set it aside. Now I can remove my gloves. I'll throw these gloves away. Mr. Jones, I'd like to place this towel over your chest while I perform the mouth care portion of this skill. Is that okay?
Yes.
I'll get the toothette ready. We're going to get it wet. Put a little bit of toothpaste on it. And then hold it in the emesis basin while I put my gloves on. Okay, Mr. Jones, I'm going to brush all areas of your mouth, the top, the bottom, the front, the back. So I need you to open up wide for me, please. I'm going to start in the back, on the top, both sides, and then the bottom and the back, the front, and can you bring your teeth together? Thank you. Okay, thank you very much, and we'll rinse. Okay, pour the rest of the water in there. And just make sure that your mouth is nice and dry. Okay, I'm going to place this in dirty linen, clean my basin, and then clean my work environment. I'll be right back. We'll take the basin to the sink and dispose of the contents into the sink. We'll then rinse the basin and set the basin down in the sink. We'll use a paper towel to pick it up, a paper towel to dry the inside, a paper towel to dry the outside, and then one more for the drawer. On the way to the drawer, we'll pick up the denture brush and the toothpaste, placing them in the emesis basin for storage. The supplies away, we'll use a paper towel to open the drawer. We're going to put the basin, toothpaste, and denture brush in the drawer and then close it with the paper towels, and we can then throw the paper towels away. And now I'll dispose of all of my disposables. The cup, the wrapper, and the toothette, along with the barrier. These will go in trash. Now I can remove my gloves. We'll throw the gloves away. Thank you very much, Mr. Jones. Is there anything else I can get for you while I'm here?
No, thank you.
Are you comfortable?
Yes.
Would you like a magazine before I go?
No, thank you.
Your environment is clean, your bed is in a low position, and you're safe. Let me give you your call light.
Okay.
Here's your call light. If you should need anything at all, just press that red button and we'll be happy to come back and help. I'm going to go open your curtain and wash my hands. After washing my hands, I'll review the care plan, make any corrections, and then tell the evaluator my skill is done. All right, any questions? Any questions on denture care? All right, so we're going to move on. Please go to page 63 in your book. We're going to talk a little bit about energy conservation before we move into our next skill. We'll be taking a break shortly. But energy conservation is a topic that students don't really think about until it's brought to your attention. And that's why we kind of have to talk about this today. Anybody ever see a 2-year-old? Yeah, 2 and 3-year-olds, that's my favorite age group. It is the most challenging age group, but it truly is my favorite. Now, one of the reasons is because they think that their experience is the only experience, that everybody sees life exactly the way they do. Everybody experiences life exactly the way they experience it. They have no frame of reference beyond themselves. The problem is that most of us never grow out of that. It's true. Have you ever tried to explain to a 2-year-old why you don't have the energy they do when they're asking you to play with them, to chase them around? Have you ever had that conversation? Yeah, I'm too tired, but come play. I'm too tired, but come play. Right? They don't get it. They don't get that you don't have the energy they do. Does that make sense? They also will tell you no for everything. If you ask them a question that has a yes, no answer, you'll always get no. The reason for that is they are trying to express their independence. They are learning that they are unique individuals. When we're working with dementia patients that have everything in their life out of control, out of their control, they will revert back to this no, because they are trying to exert some control over a situation they have no control over, just like 2 and 3-year-olds. So we usually don't use yes, no questions. We give limited choice questions. Would you like to take a walk now or after lunch? No was not an option. Would you like to wear these shoes or those shoes? No is not an option. If you give limited choice, you get better responses. Make sense? Same thing with dementia patients. Same things with children. Limited choice, not yes, no. Those of you who have small children, try this. It'll improve your communication with them tenfold. Sure, yeah. Limited choice is good. So why do I bring this up? Well, just like you trying to explain to a 2-year-old that you don't have the energy to do something, you are going to be the 2-year-old in just a moment. Because when you are working with older people and you say, hey, Miss Mary, we need to take a shower, she's probably going to say, oh, I don't have the energy for that. And you, like the 2-year-old, will try to convince her that she does. You will. You have never been that age. So you assume that her experience is your experience. But it's not. When you tell that 2-year-old, I don't have the energy to chase you, you really mean, I don't have the energy for that. And no amount of pleading or cajoling that 2-year-old does is going to get you to suddenly find some energy that isn't there. Same thing with our older patients. If we ask Miss Mary, hey, Miss Mary, would you like a shower? And she says, oh, no, I don't have the energy for that. No amount of you begging and pleading is going to magically have energy appear. Make sense? So we have to start thinking about energy levels in the elderly. And this graph helps us understand this. 2 years old is the most energy you will ever have in your lifespan. That's when you peak. That 2-year-olds will jump up and down for no reason. No reason. When was the last time you jumped up and down for no reason? Now, if I win the lottery, I'm jumping up and down. I'll buy some energy somewhere. But short of that, it ain't gonna happen. Right? 2-year-olds, tons of energy. But that energy does not last. You put a 12-year-old in charge of a 2-year-old for one afternoon, who wins? 2-year-old every time. Your energy level has fallen just in that 10-year period. And you probably haven't thought about it that way. But you don't have the same energy at 12 than you did at 2. Let's go out 10 more years, 22. Now, 22-year-olds can shop till they drop and go out at night looking fabulous, right? But you don't have the same energy level you did when you were 12. Now, 42-year-olds, yeah, they're shopping till they drop, but that's at like 3 and we're not going out tonight. Let's go out to 62. 62, our energy levels have declined so much, we're talking about retirement because there's just not enough energy to work full time and keep up with our personal obligations. So we're looking at retirement. We're putting our feet up for 10 minutes before we start making dinner because we need the break. Our energy levels have declined. Now, what do you think they're going to be like at 82? Very small. But so what, you say? Because old people, they have nothing to do and all day to do it. What do we care about their energy levels? Well, in order to understand this, we have to start thinking about what types of things in your life you do every day that take energy. What kind of things do you do that take energy? Well, the easiest way to think about this is use the phrase, have you ever been too tired to... If you've ever been too tired to do something, that means it takes energy. Have you ever been too tired to eat? Have you ever been too tired to walk? Have you ever been too tired to get dressed? Have you ever been too tired to shower?
Like lazy, not tired, but lazy.
Have you ever been too tired to talk? Now, when I leave here Mondays and Wednesdays, I am too tired to talk because I talk for 4 hours nonstop. When I get home, I need 2 or 3 hours of no conversation just to recover from this. I'm getting older. So when we look at everything that we do on a daily basis that takes energy, these are just daily living tasks. This is nothing, this is not working. This is not, going out and planting a garden. I'm talking about just to survive. Look at all the things we do that take energy. Now let's go back one screen here and look at the energy levels our 82-year-old has. Is there a problem there? If that's all we have, and that's all we have to do to survive, those two things may not match up. Make sense? This is the most common reason your patients will tell you no. I don't have the energy for that. You arguing with them is not going to magically make energy appear. So we got to be aware of this, and we've got to work in strategies to help our patients conserve what little energy they have to use it on the big things that we need it for. Make sense? Good? Okay. So remember, you are looking at this from way up here on the energy screen. Your experience is not their experience. And when we understand that, we can start thinking about energy conservation a little bit more realistically. Okay. Have you ever seen an old person try to get up out of a chair? It's called the rock and roll method. It is, because they rock before they try to roll up. Nope. Nope. Then they rock again, and they try to roll up, and then they do this climbing thing. How much energy did that take? A lot. A whole lot more energy than if I had just stood up. Now, there is a relationship between strength and energy. The less strength you have, the more energy it takes to do something. Make sense? Do you remember what we talked about last week about the signs of aging, how our musculoskeletal system weakens, our nerves don't work as well? Do you remember all those changes of aging? Well, they impact the patient in a way that decreases their strength. So that means that all of our normal daily activities, if we're less strong, is going to take more energy. Does that make sense? But we're already starting out with such little energy. And now you're telling me that I got to do all these things, and all these things are going to take more energy. So how does this impact the patient? Well, we have to think a little bit about circadian rhythms. We talked a little bit about this earlier. Remember how we said that some of us are morning people and some of us are night owls? Think about that. Some of us do better in the afternoons. Well, if we have a patient that is a morning person and really kind of drops off at around 4, if we have them on the evening shower schedule, they've run out of energy You go in to help them get a shower, what are they going to tell you? No, I don't have the energy for that. So if we know that they do better in the mornings, what do you think we should tell the nurse? Yeah, they do better in the mornings. They're refusing shower in the evening. So can we put them on the morning schedule? We might get a whole lot further with these patients by working with their energy rather than against it. Make sense? So try to find out a little bit about your patients. What kind of person are they? When do they normally do things? Some of you guys shower in the morning. I'm a morning showerer. If I don't have my shower in the morning, I do not function. I need that shower to get me going. Now, some of you shower at night. That's when you prefer to shower. Wash the day off of you. Nice and fresh and clean when you get into bed, and it makes you rest better. Those are two totally different things. So we have to find out our patients' habits, their routines, and try to work with them. Does that make sense? If you try to alter a patient's ingrained routine, you're not going to get very far. So when we understand that the patients have preferences, they have energy limitations, and they've got a whole lot that they have to do, and everything they do is going to take more energy, we have to start thinking about ways that we can help. So we can loan them some of our strength so that they don't have to use as much energy when they get up out of a chair. So you remember how much energy it took me to rock, to get up out of the chair? It took a lot of energy. Let's think about how many times we have to get up and use that method. Well, first thing in the morning, you got to get up out of bed. That's one. Then you go to the bathroom and you sit down on the toilet. Then you got to get up off the toilet. That's two. Then you come back to your room and you sit down to get dressed. You got to get up from that. That's three. You go to the dining room. You sit down in the chair and eat. You got to get up. That's four. After the dining room, you go back to your room and go back to the bathroom. And you sit down on the toilet and have to get up. That's five. And then you go to the activity room to watch a movie. You sit down in that recliner and you get up a little bit later. That's six. And you go to the bathroom and sit down on the toilet. And you have to get up. That's seven. And this is all before lunch. If they've only got this much energy and it takes so much energy to get out of the chair, this is going to wear them out long before they get to dinner. Now, if they're too tired to eat dinner, remember, have you ever been too tired too? If they're too tired to eat dinner, what do you think that's going to do to tomorrow's energy levels? They're going to be less because they don't have the fuel on board. This creates a downward spiral that can lead to failure to thrive and kill your patients. This is how serious this subject is. So if we can do something to help offset their energy needs, conserve their energy to be able to eat well today so they have energy tomorrow, then we're going to do that. And one of the ways we do that is with a Gait belt. A Gait belt is a flat canvas belt that goes around the patient's waist that we can use to lift our patient to a standing position using our strength instead of their energy. Good? That is why we use Gait belts, to help with energy conservation. Make sense? Okay. So let's talk about Gait belts and how we use them. Page 66 is our overview of ambulate with a Gait belt. Put that out of the way. If you look down the screen here, you'll see our overview. We're going to follow the care plan, do our opening, evaluate if we need gloves. We may. If the patient has an open wound, do we need gloves? Yeah. If they're leaking body fluids, if they're incontinent, do we need gloves? Yeah. If your patient is a testing student that is fully clothed and holding onto all of their body fluids like a champ, do you need gloves? No. Remember, evaluate it per patient. We're going to follow shoe rules, which we're going to talk about in just a moment, and we're going to do our closing. We know all of those things. Down here is your test-specific information. Somebody with your level of experience should be able to do this in 5 minutes or less. It's going to be done on another testing student, and they're going to start the skill in a chair. Now, in this class, when you're practicing this skill, do not practice it in a rolling chair. You need to be in a stationary chair. So Jake will bring the stationary chair out for you to be able to practice this skill in a stationary chair. Please don't use a rolling chair. It'll roll away from somebody. Somebody will fall. Okay. All right, so let's talk about shoe rules. On page 67 at the top of the screen, you can see our care plan. It says to ambulate the resident at least 10 steps, use a gait or transfer belt. Patient will be sitting in a chair at the side of the bed with shoes on. Patient is able to walk but needs assistance to stand. That's our care plan. Tells us everything we need to know. But let's learn how to do this. So slipper socks are not enough. We don't want to walk somebody in just slipper socks because that doesn't protect against sharp objects and blunt force injury. So we need shoes. If you're going to walk a patient, you need shoes. Remember we talked about this? You need shoes on the patient. What if the patient doesn't have shoes? Who would we tell? The nurse. The nurse has this great invention called a phone. They can call up the patient's family and say, hey, bring George's shoes down. Or they can call the facility the patient came from and say, hey, we need Matilda's shoes. Or if the patient is homeless and has no shoes, they can call a social worker and say, hey, we can't discharge this patient without shoes. And the discharge planner and the social worker will get shoes for the patient. Okay, we can solve that problem. We can't solve the problem if we don't know there's a problem, and that's where you come in. So don't walk a patient in slipper socks. Thankfully, for this skill, a patient already has shoes on. We don't have to worry about it, but you need to know this. We're going to put the gait belt around the patient. Now, when you put a gait belt on a patient, this is what a gait belt looks like. Has a buckle on one end, it has a free end on the other, and there's a tag. This tag has to go inside like every other article of clothing. When you put your shirt on, you make sure the tag is on the inside. Same thing with this. It doesn't matter when you put this on whether the buckle faces this way or the buckle faces this way. It doesn't matter. Nobody cares as long as that tag is on the inside. So you put this around the patient's waist. And when you put it around the patient's waist, you don't want it twisted. So see how that's flat? You don't want it twisted. It has to be flat. Pay attention to that. And then you put the free end through the first guard by the alligator teeth. Jake, can you zoom in for me? Please. That's good. All right, so we put the free end. Can you guys see the screen? If I move just a little bit. There we go. Can everybody see? No, that's good. Free end through the first guard by the alligator teeth. Just like that. Now, those teeth actually tell you which way to pull this. If I try to pull it this way, it's not going to go anywhere. Those teeth are all pointing that direction, so we're going to pull the tail that direction. And we want to pull it so it's snug. You only want to be able to fit 4 fingers between the belt and the patient. If it's too loose, when I go to lift the patient, it's going to go up underneath the breasts, underneath the arms, or the patient's going to slide right out of it. Any of those can cause injury. So we want it to stay in place. The only way to get it to stay in place is to get it snug enough that you can only fit 4 fingers. Now, this end, we have to lock it in place. Otherwise, when I go to lift, it's going to loosen up. We need to lock it in place. So now this end goes through the second guard, and that locks it into place. This tail, if it's hanging down and too long and in your way, just tuck it into the belt. Now to remove the gait belt at the end of the skill, we're going to take it out of that second guard. And instead of pulling to tighten, which is what we did before, instead of pulling the tail, we're just going to hold the tail and we're going to slide the buckle along the tail. So to tighten, we pull the tail. To loosen, we slide the buckle. And then we take it completely off. Don't slide this against the patient's skin. Take a listen to what this sounds like. See if you can hear this. Can you hear that? That can cause a burn. So we don't want to pull this against the patient's clothing. You want to hold that buckle in the palm of your hand so it's secure and then loop it up and over. Or you can reach around the back of the patient if they're not too large and hand the buckle over to the hand that's holding the tail. But don't pull against the skin. Good. So gait belts, when you put them on, you want to check them with 4 fingers to make sure that it's snug enough. It's not going to move when we go ahead and pull out, Jake. Thank you. Now, before we lift a patient to a standing position, you want to make sure their feet are flat on the floor. Now, this is a problem for me. I've got very short legs. My feet don't stay flat on the floor. Like if I sit in a chair, the soles of my feet are not on the floor. I'm on my tiptoes. If you try to lift me up and I'm on my tiptoes, what's going to happen? I'm going to fall. I'm going to go forward. So you want to make sure the patient's feet are flat on the floor before you stand them up. That means that they may have to scoot their hips forward a little bit to get their feet flat on the floor, but it's something you need to say during the test. Are your feet flat on the floor? We're going to reach around the back of the gait belt and hold that gait belt either on the sides or around the back, as far back as we can, to help our patients stand up. When we do that, we want their hands on our shoulders as we lift them. But we're going to use a very specific stance during the lift. I'm going to get to that in just a second. Before we lift them to a standing position, we want to count to 3. 1, 2, 3, stand. That way they're a partner. We're not just manhandling them. So this is the position we want to be in when we're helping somebody stand. We used to teach people to stand right in front of somebody, knee to knee, toe to toe, grab the gait belt and stand them up. But the problem is physics. Every action has an equal and opposite reaction. So if I've got a 150-pound patient that I'm pulling toward me, that means that's 150 pounds of force forcing my back to go backwards to compensate. That's a lot of force on my lower back. That's not stable. I'm likely to fall and bring the patient with me. So we don't like that. We don't like standing toe to toe with the patient. Instead, we're going to stand off to one side. So I'm going to put one foot perpendicular or across in front of their feet. And the other foot will go parallel to their body. So you see this foot is across in front of their feet. This foot is parallel to the chair. And I'm going to bend at the knees, not the waist, to stand the patient up. When you do this, this is a much more stable platform for lifting. Once we get them standing, we want to ask, are you dizzy? I want to know there. Doesn't do me any good to get 10 feet down the hallway and ask, are you dizzy? And they say yes. What am I supposed to do with that? Don't be dizzy. What do I do with that? What most people do is they try to hurry the patient back to safety. Guys, if they're not tolerating a slow walk, you really think they're going to tolerate a rush? They're going to end up on the floor. They're going to fall. So we want to know when we stand them up, how are you feeling? Are you dizzy? Are you nauseous? Everything okay? You good to walk? We want to know here, because if something is going wrong now with just a stand, we need to sit them down and go get a nurse, because we don't get paid to handle that. That's a nurse's problem, not ours. So stand them up and ask, are you dizzy? Oh, spoiler alert, for the test, they won't be. You can walk. So we're going to walk. Now, our care plan told us 10 steps. That's 5 steps in one direction and 5 steps back. We're not walking far. In fact, the test is going to give you a very specific destination. The care plan will say 10 steps, but the evaluator will say walk to the table and back, walk to the door and back, walk to the bookcase and back. They're going to give you a destination. And the reason for that is they aren't really watching. The walking isn't the focus here. It's all this other stuff. They don't need to see a ton of steps here. But they do want to look at one thing when it comes to the walk. Who are you paying attention to? Because when you're walking somebody, you've got the gait belt and an underhand grip, and you're standing slightly behind them. So your patient should be right here, just in front of you. You should be on one side, slightly behind. And when you're walking, they should be your full focus. Not down the hallway, not the TV, not your watch, not your cell phone, not another CNA. It's the patient. Because patients don't just walk along, I'm good, I'm good, I'm good. It doesn't happen like that. Patients will let us know that something is going very wrong. They slow down. They get a little wobbly. They get pale and sweaty. They put a hand out to the wall or to their head or to their stomach. Patients will let you know that something is going very wrong. And if you're not watching that patient, you will miss it. And it will seem like we were just walking, and the next thing I know, they're on the floor. That tells me you weren't watching the patient. So when you're doing these 10 steps, that's what they're looking at. Who is your focus on? We don't need a lot of steps to see that. Good? So you're going to walk them 5 steps in one direction, turn them around, walk them 5 steps back to the chair. Pay attention to the patient. When we get them back to the chair, we want to back them up so the back of their legs hit that chair and they know it's there. This is a testing checkpoint. That patient has to know that chair is behind them, and they have to be able to verbalize that they know that chair is behind them. So can you feel the chair behind your legs? Once your patient can feel that chair, we're going to help them sit using that same body mechanics. Exactly the same, holding the gait belt at the sides or the back and controlled lowering to the chair. Good? It's a 5-minute skill. We're putting a gait belt on, standing them up, walking them 5 steps, turning around, walking back, helping them sit, taking the gait belt off, and doing our closing. It's an easy skill. Super easy. But every one of those checkpoints counts big. You miss one checkpoint on this one and it could fail you because it's all safety. The number one risk to a patient in a facility is falls. That is the number one risk. And if we're moving a patient, they're at risk of falling. So every one of those checkpoints is going to count big. Good? Questions? Make sure you're removing any obstacles before you stand them up. So if there's a tray table in your pathway, remember I said the evaluators are going to give you a destination, like walk to the table and back. If there's something in your way, move it before you stand the patient. You don't want to leave the patient standing there to go move an obstacle. You don't want to try to move your patient around an obstacle. Remember, falls are the number one risk. So if there's an obstacle, move it. This is one of those things that sometimes your evaluators go a little rogue. Evaluators are people, and they're supposed to stick to the script because testing has to be uniform. But there are a few evaluators out there that will intentionally put one of these rolling tables in your path to see what you're going to do. Sometimes evaluators go a little rogue. They're not supposed to do that, but sometimes they do. So look for an obstacle when they tell you where to walk. All right. So we'll put the gait belt on while the patient is sitting. It goes over their clothing. I don't know why that's a checkpoint. Who would put a gait belt under clothing? It goes over the clothing. Help the patient to stand by holding on to the side or back of the gait belt. Let them lead. Walk slightly behind and to one side. Hold the gait belt underhanded. Pay attention to your patient. Ask how they feel. Help them stand and sit. Don't pull the gait belt across the skin, and check their body position after they're sitting. Make sure the hips are back against the back of the chair. Okay. Oops. All right. So let's go ahead and watch this video, and then we'll take our break. Go ahead, Jake.
Hello.
Good afternoon, Mr. Jones. My name is Patty, and I'm your CNA today. How are you?
I'm well. How are you?
Fantastic. Do you feel like going for a little walk?
Yes, that'd be lovely.
I'm going to close your curtain, wash my hands, get my supplies, and I'll be right back. I'm going to clear the walkway of obstructions. We'll close the privacy curtain and wash my hands. Now that I have clean hands, I'll get the gait belt. Mr. Jones, I see you have non-skid footwear on. Does it fit appropriately?
Yes.
Very good. This gait belt I'm going to put around your waist. It's going to help me lift you to a standing position and provide a little stability as we walk. Is that okay?
Yes.
Okay, I'm just going to slide this around your back. Okay, and lift your arms and relax. We're going to put the free end through the first guard by the alligator teeth and pull it so that it tightens the belt. We want the belt to be snug. We want to only be able to fit 4 fingers between the belt and the patient, and then we'll lock it in place by putting the free end through the second guard. And then we'll place the free end through the top just to hold it in place. Okay, Mr. Jones, your feet are together. In just a few moments, I'm going to have you place your hands on my shoulders, and I'm going to place my hands around your back. And on the count of 3, we're going to stand together. Okay?
Okay.
So I'll put 1 foot in front of your feet to keep them from sliding out, 1 foot beside the chair to keep me at an oblique angle. Go ahead and put your hands up here. And on the count of 3, we're going to stand. 1, 2, 3. Thank you very much. Are you dizzy at all?
No.
Okay. So at your pace, when you're ready, I'm going to have you lead, and we're going to walk to the wall. I'll walk slightly behind and to one side, watching the patient. Okay, and go ahead and turn. And then we're going to walk back to the chair. Are you dizzy at all?
No.
Very good. So when you get to the chair, if you can turn around for me and back up so that your knees hit the chair, come my way just a little bit. And on the count of 3, can you feel the chair behind you?
Yes.
You're going to place your hands on my shoulders. Go ahead. I'm going to put 1 foot in front and 1 foot beside. And on the count of 3, we're going to lower. Ready?
Yes.
1, 2, 3. Being careful to bend at the knees and not the back. I'll remove the gait belt by taking it out of the second guard and then removing it from the first guard. We're going to remove it by looping it over the patient, being careful not to let any part hit the patient. And are you comfortable?
Yes.
Could you slide back so that your hips are against the back of the chair? Very good. I'm just going to go put the gait belt away. Are you comfortable, Mr. Jones?
Yes, ma'am.
Is there anything else I can get for you while I'm here?
No, thank you.
Okay, your environment is clean. I'm going to hand you your call light. Here's your call light. If you need anything at all, just press that red button and somebody will be happy to help you. I'm going to open your curtain and wash my hands. After washing my hands, I'll review the care plan, make any corrections that need to be made, and then tell the evaluator my skill is done. All right. Any questions on that skill? That's one I would want. It's an easy skill. Gait belt is on the supply cabinet for you guys to be able to practice with in just a little bit. We're going to go ahead and take our break. We'll do 15 minutes. When you get back, we have one more skill to cover today, but it's a big one. It is the longest skill we have. It's partial bed bath. Not much I have to teach you here. We already know all the principles involved, but we do have to learn a new way of using a washcloth. So we'll get to that right after the break. And once that skill is done, we'll have some time for practice. Okay? All right. 96. All right, so we're going to move on to the last skill for today, which is partial bed bath. The introduction for this is on page 126. You can see that this one uses almost every principle that we have learned. So if you look at the principles down the short form down here, they're all spelled out for you here. We're going to use skill rules, which means we're going to follow the care plan. Every skill starts with the opening. We'll evaluate if we need gloves. We're going to use a barrier. We're going to use privacy blanket. We'll use linens, scoot and roll to make sure the patient's always in the middle of the bed, washing rules, basin cleaning, and the closing. This covers pretty much everything. It's a long skill. If you look down here, somebody with your level of experience should be able to do this skill in 19 minutes or less. It's a long skill. They give you more time than you need. It doesn't take 19 minutes to do this as long as you kind of have an idea of how it's done. But they give you quite a bit of time because it is pretty extensive. Let's take a look at the care plan for this one. If you look at the top of page 127, the care plan says, give the resident a partial bed bath and back rub. Now, I'm going to stop there for a second. A back rub does not mean deep tissue massage. That's not what we're doing. A back rub is just basically 3 small circle passes just to wake up the nerve endings, promote circulation, make the patient feel a little better. It's not a massage. It's just a little back rub, okay? It then tells us, because it's a partial bed bath, it has to tell us exactly what to wash. So this care plan is very detailed. It says to wash the resident's face, neck, chest, abdomen, back, and one arm and hand. What if the patient has 2? Follow the care plan. So we're only going to do 1. Test doesn't care which one. Pick one. They don't care. Just 1. Provide a brief back rub. Oh, I'm sorry, with soap and water. It tells us what to use. Provide a brief back rub with lotion. Dress the resident. Dress the resident in a clean hospital gown after bathing. Patient is lying on back in the center of bed and can roll as directed, but is too weak to assist with bathing. That's the care plan. So please pay attention. It's telling us exactly what to wash. There is no question here. Exactly what to wash. Your supplies are going to be located at the bottom of the screen here, but I want you to pay, I want to talk about the washcloths. It says 4 washcloths there. You can use 5 if you want to. There's a way to do this with 4 washcloths. It's easier to do it with 5. I don't care which one you use. I show you how to do it with 4 because when you go out to work, you are never going to have enough supplies on the supply shelf. There will always be a supply shortage. Always. That's because facilities run out of supplies. CNAs throw things away instead of cleaning them. Stuff might be in laundry and hasn't come back yet. A lot of CNAs will take they'll go in first thing at the beginning of the shift, take all the supplies they need and put them in their rooms so that they don't run out. It's like the Wild West out there with supplies. So you need to know how to do these skills with as few supplies as possible. So I show you how to do this skill with 4 washcloths. But understand that if you don't want to reuse one of them, we can reuse rinsing washcloths. Rinsing washcloths can be reused as long as they haven't touched a wet body opening. Okay, rinsing washcloths. Remember we talked about wet body openings? As long as a washcloth hasn't touched a wet body opening, just intact skin, and it was a rinsing washcloth, it can be reused. So I'm going to show you how to do that so that if you find yourself in a situation where you don't have enough washcloths, you know how to do it. But if you want to use 5 and use a fresh washcloth for every wash and every rinse stroke, that's fine. You can do that. Everybody understand that? Okay. All right. We have step-by-step instructions But this box right here really sums up what the care plan told us to do. Face to waist, front and back, one arm and hand. Okay. Kind of sums up that care plan. We always start with the face. Always wash the face first. And we don't use soap on the face because soap dries the skin and can sting the eyes. So no soap on the face, just water. Okay, good, good. All right, so we've learned the washing rules. We went over this before. We don't put soap in the basin. We use a paper towel to turn our faucet on. We check it. It should feel warm, not hot, not cold. We ask our patient to check it. Whatever we wash, we rinse. Whatever rinse, we dry. We change the water if it gets cold or soapy. And this skill, because it's so long, that actually might apply. So pay attention to if your water gets cold. And then warm lotion before we put it on and then wipe off the excess. Try not to get your surfaces wet. Barrier on the table, towel on the bed. Try to keep your surfaces as dry as possible at the end of the skill. Good? Everybody understand that? But we did skip one washing rule, which we're going to go over now. And that is we're going to use the leaves method for wet body openings. Now, we're going to go through these washing rules one at a time as a refresher because all of these are going to apply to the test, and these are what we're really being graded on for the test. This is where most of your checkpoints are going to come in on the test. So we don't add soap to the basin. We'd use paper towel to turn our water on. It should feel warm. Your patient has to check it. We're going to change the water if it gets cold or soapy. We're going to wash, rinse, and dry. Let's see here. Oh, don't get your surface wet. And lotion is warmed up, then wiped off. But let's get into the leaves method. So this is a plain square washcloth. All of you guys have one of these in front of you. If you're playing along at home, go get a plain square washcloth. We are going to use the leaves method, this new way of washing, if we're going to wash any wet body parts, any wet body openings. We learned this in class 2. Remember, a wet body opening is a doorway out or a doorway in. Eyes, nose, mouth, genitals, rectal area, wounds, rashes, sores, or incisions. These are wet body openings. If we're going to wash any of these, we have to have a special way of doing it to help prevent cross-contamination. So this is a plain square washcloth. If we fold it in half and in half again, we get a small square washcloth. Now, instead of looking at it as a square, we're going to turn it a quarter turn and look at it as a diamond. And when we look at it as a diamond, I want these free flaps at the top. So the folded corner at the bottom and the free flaps at the top. This is what it looks like. So everybody hold your diamond by the flaps at the top. Okay. Now you're going to take your hand and put that washcloth on the palm of your hand with the flaps at the top. You're going to tuck in the side by your thumb and tuck in the other side between your pinky and ring finger. Now, we can wipe something and then fold that leaf over, and that traps the contamination underneath. This gives us a new cleaning surface. We can fold that over, and that traps the contamination underneath and gives us a new cleaning surface. We can fold that over. I'm just going to turn you a quarter turn because we want these leaves up here. There we go. Like that. Yep. So we can fold that over and gives us a new cleaning surface. And we can even, that last one, we can even fold that over and that gives us a new cleaning surface. So we have 5 independent cleaning surfaces on this one washcloth without cross-contamination. Because I don't want to take contamination from here and put it here. Remember, these are doorways in as well as out. So if we're going to wash any of these areas, we use the leaves method. 1 washcloth to wash, 1 washcloth to rinse. Good. Now, we can't reuse the rinsing ones if they've touched any of these areas. But a rinsing washcloth that is just rinsed intact skin can be reused if you need to. Good? Questions? So here's a picture of how this works. So we have our washcloth with the free ends at the top. We wipe something and then we fold it over. That gives us a new area to wipe with, and then we fold that over. New area to wipe with, and we fold that over. And a new area to wipe with, and we can fold that over and use the back side as well. 5 cleaning surfaces. And this is called the leaves method. So let's look at our care plan here. It tells us to wash the face. Okay, let's stop there. The face, we have 1 body opening, 2, 3, 4 body openings. I don't want to use the same area of the washcloth for each one of those. So we're going to wipe 1, fold our washcloth, wipe another, fold our washcloth, wipe the skin and the mouth, fold our washcloth, and then wipe the nose with the last one. I do the nose last because boogers, you know. Good? Good? All right, then it says neck, chest, abdomen. That's all intact skin. There's nothing, no body openings there. So I just need 1 washcloth, just a plain washcloth. Don't need to use the leaves because all of that skin is intact. So neck, chest, abdomen, side, down the arm, the hand, up the back of the arm. I do the armpit last because pits. And we're going to set that aside. We're going to get another one to rinse all of those areas. Good? Any questions so far? Okay, do you guys understand the leaves method and when it's used? Okay. All right, so we're going to wash the face first. No soap because soap stings the eyes and dries the skin. And then we'll use the leaves method on the eyes, nose, mouth. We're going to wring out washcloths, no drippy, wet washcloths, and we apply soap to the washcloth, not the water, and not the patient. Somebody did that recently. A student came back and told me they saw another student testing, and they just took the spray soap and just sprayed it on the person. Don't do that. I never thought to tell students don't do that, but don't do that. Soap goes on the wet washcloth. Anytime we lift something, we support it from below with a flat palm. That we know that. We've learned that. Everything that we use, we're going to put on the barrier. Should we throw it on the floor? Nothing goes on the floor. We're going to put it on the barrier. So we want a clean area, and then we want an area for our used washcloths. We're going to scoot the patient toward us and roll them on their side because they always have to be in the middle of the bed. We're going to wash, rinse, and dry the back. It's all intact skin, so just wash, rinse, and dry the back. After you do that, you want to warm the lotion up in your hands, give a little back rub. I start at the base of the back, go in small circles to the shoulders, and do that 3 times. And 1 more, and I'm done. But when we put lotion on, what do we have to do? Wipe off the excess. Yeah, warm it up first, wipe off the excess. We're going to change the gown because clean body deserves a clean gown. That just makes sense. Now, you can change a gown. I don't care when. Nobody cares when. It's not a graded checkpoint. Whenever you want to do the gown is fine. But I'm all about time management because you've got way too much to do and not enough time to do it. So what you're going to see me do is I start with the face because face first. Clean the face. Then I take the gown, clean the torso, the front of the torso, wash, rinse, dry. I will put that new gown on before I wash the back. That way, the front of the patient, all done. Turn them on their side, wash, rinse, dry the back, and now all I got to do is tie that gown. Now, the alternative method is to wash the front, turn the patient, wash, rinse, dry the back, give them a bath scrub, put them back on their back, put the gown on, put them back on their side, tie the gown. That's a whole lot of work. This is easier. Clean the front, dress the front, turn them on their side, clean the back, tie the gown. Good? Pretty easy, right? All right. Remember that you do need a barrier to put all of your clean supplies on. And that barrier will also hold our dirty washcloths after use. We're going to fill the basin, check the water temperature, let our patient check the water temperature. We'll protect the sheets with a towel. So we're going to lean the patient forward, untie that gown to get it off of them, and put a towel there to protect our sheets while we've got them leaning forward. We're going to use a privacy blanket for this. We do need gloves, wet body openings. Remember, non-intact skin, those are wet body openings. First thing your gloves should touch is the patient. So we're going to start with the eyes, inner to outer corner. Fold the leaf, go to the other eye. Inner to outer corner, fold the leaf, wash the face, fold the leaf, clean the nose. Whatever we rinse, we dry. Or yeah, we don't use soap, so this is a rinsing. Whatever we rinse, we dry. Then we're going to wash the whole torso of the patient, rinse and dry, dress them, scoot and roll so they're in the middle of the bed, wash, rinse, and dry the back. Give them a little back rub with lotion, tie the gown. And now your patient is on their back, covered with a blanket, in a new gown, clean, ready to go. But we've got to take care of all of our supplies. We cannot take that privacy blanket off with dirty gloves on. So your patient is fine. They're in the middle of the bed and covered. Leave them there. Let's go take care of our dirty supplies. Put them in the hamper. We're also going to go clean our basin and store it. Then we can take off our gloves and remove the privacy blanket and do our closing. You guys understand the steps? Are you starting to see that the things that you learned in week 1, we're just repeating those? That's all we're doing is repeating, rinse and repeat, rinse and repeat, rinse and repeat. That's the way the rest of the class is going to go too. There's nothing new to learn. You have now learned everything you need to learn. We're just going to put all of those pieces together and make skills out of them. So the class really is kind of easy from this point. The worst of it is behind you. The learning part is behind you. You remember on day 1, I told you you're going to learn everything on that back wall? Yeah, well, you did that by class 4. You didn't memorize it, you learned it. There's a difference. Okay? Look how far you've come. I'm super proud of you. I am super proud of all of you. Look how far you've come. I'm not done with you yet, but look how far you've come. All right. So we're going to go ahead and watch this video that has close-ups of each one of these steps. It also has the testing checkpoints at the bottom of the screen. This video takes, I think, 12 minutes, I think. It's not very long. It's not 19, that's for sure. And then after that, the rest of the class you will have for practice. Okay, we will go over homework before that. So after the video, we'll talk about homework. We'll give you your review sheets and everything. During practice, I sign off of online. They don't need to see you guys practice. So when we watch the video, I'm going to talk a little bit more. I'll sign off, and then the room will be yours. Okay? All right. Yeah, you should have, we're going to be pretty close. Should have about an hour of practice time today. Should be pretty close. All right, Jake. Good morning, Miss Jones. My name is Patty. I'm your CNA today. How are you? Fantastic. I'd like to provide a partial bed bath. Is that okay? Wonderful. I'm going to close the curtain, wash my hands, get my supplies, and I'll be right back. Now that I've washed my hands, I can gather my supplies. I'm going to place the supplies on the overbed table. We'll start with a barrier, unfolding the barrier so the absorbent side is facing up, and this gives us a clean place to put our clean supplies. For this skill, we're going to need 2 towels, 4 washcloths, 1, 2, 3, and 4. I need a privacy blanket and a clean gown. Being careful not to hold the clothing against your uniform. I'll bring this over to the patient area. We'll bring this over here within reach, and then I'm going to get the supplies out of the drawer that I need. We're going to open the middle drawer and remove the basin, soap, and lotion. I'll put these on the overbed table. And I'm going to get a set of gloves. Okay, Miss Jones, I'm just going to get some water in the basin. I'll be right back. I'll use a paper towel to turn the faucet on. Check the water temperature with the inside of my wrist. It should feel warm, not hot, not cold. And we'll fill the basin about 1/4 of the way full. Okay, Miss Jones, I have the supplies here. Would you like to check the water temperature and make sure it's okay? It's good? Very good. Okay. So I'll put the washcloths in the water. And the first thing that we're going to do is place a privacy blanket over you. This is going to help keep you warm and provide privacy while we do this skill. We're going to spread this out without snapping it or shaking it. Placing it over the sheet. And I'm going to pull your sheet down to just below your waist. Okay, now I'm going to put the towel on the bed. This is going to help keep your sheets dry, and we'll untie your gown. So I'm going to help you sit up by putting my hand on your upper back, and on the count of 3, we're going to sit. 1, 2, 3. Very good. I'm going to untie your gown. And then we'll spread that towel out underneath the areas that we're going to wash. Come on back. Very good. And I'm going to remove the gown on the side closest to me, supporting at the elbow as I lift. Okay, Miss Jones, go ahead and bend your elbow. Thank you. And then we'll move the gown over to the other side, making sure that you're covered at all times. Now we're ready to start washing, so I'll go ahead and put my gloves on. We'll take the first washcloth, wring it out really well, and then I'm going to hold the washcloth in my hand so the free leaves are at my fingertips and tuck in the 2 side corners. And this allows us to use a different leaf for each area that we're going to clean on the face. After wringing out the washcloth, no drippy wet washcloths, we're going to wash your face first. I'll start with your closest eye, and we're going to wash inner to outer corner using the leaves method, which is going to help prevent cross-contamination. So with the first leaf, we're going to wash the inner to outer corner of this eye. We'll fold that leaf over. And with the second leaf, we'll wash the inner to outer corner of that eye. Fold that leaf over, and with the third leaf, we'll wash the remaining skin of the face. We'll fold that leaf over, and with the last leaf, we'll wash the nose. And we're going to put this on the barrier. Whatever we rinse, we dry. So I'm going to take the towel and fold it around my hand so I have control over it, and I'm going to pat all of those areas dry using short, soft strokes or a patting motion. We'll set the towel aside. Okay, now we're going to take washcloth number 2 and wring it out really well so that it's not drippy wet. And then we'll apply soap to the top leaf. We're going to start cleaning the neck, behind the ears, under the chin, across the neck, the upper torso, down to the breast, keeping the patient covered at all times to protect modesty, down to the belly button, and up the side. Now, for the test, you will keep the patient covered. The evaluator will ask you to move the blanket if they would like to see. I'm going to go ahead and remove the blanket now so that you can see what I'm going to do. So we're going to move the blanket down, and I'm going to start again to show you how to clean the patient. So under the chin, behind the ears, across the neck, the upper chest, around the breasts. When you lift the breasts, we lift not with the palm, but with the back of our hand to lift the breast to clean underneath, down to the belly button, up the side, down the front of the arm, all the way to the hand, supporting the elbow at all times, either with your hand or the bed, up the back of the arm, and we'll clean the armpit last. We're going to set that on the barrier. Whatever we wash, we rinse. So I'm going to get a rinsing washcloth, and we're going to rinse all of those areas the same way. So behind the ears, under the chin, across the neck, upper torso, around the breasts, down to the belly button, up the side, down the shoulder and the front of the arm, supporting the elbow, the hand, lifting the arm from below, washing the underside of the arm and the armpit last. We'll set that washcloth back in the basin for future use. We're going to take the towel, controlling the edges, and we're going to pat all of those areas dry or use short, soft strokes. Nothing vigorous. So the abdomen, down the arm, lift the arm up, support at the elbow, dry the hand, lift the arm to dry the underside of the arm and the armpit. We'll set this aside. Now, the care plan only asked us to clean one arm. So we don't have to go over and clean the other arm. And that's because that's what the care plan instructed. In some cases, you will have to clean both arms. In that case, you would just do that at this time. But for right now, we only had to clean one arm. We did that, so we're going to dress the resident in her gown. I'm going to spread the gown out, put my hand in through backwards on the armhole, lift her hand by holding her fingers together to place the sleeve over the arm, and then I'll lift at the elbow to bring the gown up. I'm going to make sure that gown is covering her. Put the privacy blanket back in place, and now I'll go to the other side of the bed to remove the old gown and put the new one on. Okay, now I'm going to move the blanket and remove the gown from this arm by sliding it off the arm, lifting the elbow from below with a flat palm, and then this will go in dirty linen. Now I can put the new gown on this arm by putting my hand in through the armhole backwards, grasping her hand, and sliding the gown over. We're going to lift from below at the elbow and make sure that the gown is properly in place. Now I'm going to go back to the other side of the bed. Okay, Miss Jones, I'm going to wash your back now. So I'm going to pull you toward me and turn you up on your side, and that way you're in the middle of the bed after the turn. Okay, go ahead and slide toward me. And then you're going to roll on your side. 1, 2, 3. Thank you very much. The evaluator will hold the mannequin in place during your cleaning, during the test. Live patients, of course, can lay on their side. So I'm going to ask the evaluator to please hold the mannequin in place for me. Thank you. We'll slide this towel down so it's covering the bed underneath the back. We're going to take our third washcloth, wring it out really well, and we'll apply soap to the top leaf. I'm going to wash the back from the neck down to the shoulders, all the way down to the waist. We'll set this washcloth aside, and we'll get our rinsing washcloth. So we'll wring that out, and we'll rinse the same way we washed. The back of the neck, the shoulders, all the way down to the waist. We'll set that aside, and we'll take our towel to dry those areas. So I'm going to pat dry or use short, soft strokes and dry all of those areas. Now the care plan asks me to provide a brief back rub. So I'm going to take my lotion, put a little bit in my hands, and then I'm going to warm it up by rubbing my hands together. We're going to start at the base of the back and go up in small circles to the shoulders, and we'll do this 3 times. To the shoulders, come down, up to the shoulders and come down. And then we'll take the towel and wipe off the excess lotion. We'll remove that towel from the bed, putting it on the overbed table, and then we'll tie the gown. Come on back, Miss Jones, onto your back, and then scoot to the middle. Thank you. Okay, you're covered and safely in the middle of the bed. Let me go dispose of all of my supplies, and I'll be right back. So I'm going to put all of the supplies in dirty linen, being careful not to hold them against my uniform. And now I'm going to clean my basin, and we'll dispose of the water in the sink. Rinse the basin, and then dispose of the rinse water into the sink as well. I'm going to set that down, disinfect it per facility policy, and then pick it up with a paper towel. I'm going to get a clean paper towel to dry the inside. I'm going to get a clean paper towel to dry the outside. And then one more for the drawer. Okay, on the way, I'll place the lotion and the soap into the basin using a paper towel. And then I will use the paper towel to open the middle drawer and slide the basin with the soap and lotion into the drawer. We'll close the drawer with the paper towel and then throw them away. I'm going to remove the barrier, throw it away, and then I can remove my gloves. Okay, Ms. Jones, I'm going to move your privacy blanket now. So as I pull the blanket up, I'll restore the sheet. This preserves modesty and keeps the patient warm. We'll roll the privacy blanket up in a ball so that trailing edges don't contaminate other surfaces. Okay, I'm going to place this in dirty linen. We'll return the table to storage. Adjust the sheet for neatness and appearance. Okay, Miss Jones, are you comfortable? Is there anything else I can get for you while I'm here? Okay, let me place the call light in your hand. So there you go. The call light is in your hand. If you need anything at all, please press that red button. We'll be happy to come help you. Bed is in the low position. The environment is clean. I'm going to open your curtain and go wash my hands. After washing my hands, I'll review the care plan to make sure that everything in the care plan was addressed with this skill. I'll think about my skill and make any corrections that need to be made. And once I'm happy, I'll tell the evaluator my skill is done.
Light.
Oops, sorry. All right, any questions on partial bed bath? It does take a while. I mean, there's a lot of body there to wash, but you don't have a huge chance of getting this particular skill. It is on the care plan sets, but it's only on one. So you've got a 1 in 11 chance of getting this skill. It's not too bad. The good news is if you get this skill, you get 2 super short skills to go with it. So like range of motion and respirations. So 2 super short skills to go with this. So it's really not too terribly bad. So any questions on this skill? Okay, you have 1 chapter of homework for tonight. It's chapter 7, which is another skills chapter. Read the paragraphs in between the skills. Of course, we're covering the skills in class. Anything that we're not covering in class, you might want to just take a quick look through. Like showering, we don't do showering in class. So take a quick look through it. Okay. Good. Jake handed out your review sheets. Those are for today's lesson. You should be able to, at the end of each class, when you get these review sheets, you should be able to answer all of these questions without looking up anything. And if you do that, then these sheets make a great review packet for right before you go test, because it's going to cover absolutely everything you need to remember, all the important points. Sounds good? Any final questions before we sign off? All right, those of you who joined us remotely, thank you so much for joining. We'll be back on Wednesday for class 6, and class 6 is our very last review. So after class 6, there won't be any more reviews. So if you get a chance, make sure you tune in on Wednesday, at least at the beginning, for the review. And then next week, we have class 7 on Monday, the game show on Tuesday, and they graduate out on Wednesday. So please make sure you tune in for that. And I will tell you a very unique way of figuring out what to say during an interview when they ask you, tell me a little bit about yourself. And everybody always freezes. I actually have a formula you can use to create your own tell me a little bit about yourself, where you're going to sound very intriguing, engaged, and an asset to their company. It'll help you ace your interview. So make sure you tune in to class 8 for that. All right, until next time, we will see you then. Happy caregiving. Bye.